be alarmed because you can have some colostrum come out. Don't bother saving it, you'll have more. But if you do see something like that come out, it's just fine. After, like I said, after 37 weeks, you can ask the provider if it's okay to start doing some nipple stimulation. The other big thing that I want you to write a note on here is if you go to the hospital, bring your breast pump if you have one, because if labor slows down in the hospital, and there are then starting to talk about having some, you need this? Yeah. If they're talking about some interventions while you're there at the hospital because things aren't moving, what I would ask is, can we get on the breast pump and see if that gets things going? So labor started or water is broken, you're in the hospital, then you can get on the breast pump too. And the last thing you want is to send somebody home to dig through the nursery and the pile of boxes to find the breast pump. You just want to take that in your bag, right? The next, my third favorite one is acupuncture or acupressure, but acupuncture is more effective. Obviously, it's a little bit greater of an intervention.
Which one is?
Acupuncture. When you're actually, acupressure is just the manipulation with hands to get things going on certain pressure points, but the acupuncture is actually in it, you get poked. And my suggestion, and I just love her, I'm sure everyone in town is great, but Kate Higgins knows her stuff. And she is a fantastic pre-labor acupuncturist. She knows what she's doing, and she can, again, that low-hanging fruit, she can get things going if needed. She has a regimen, she'll come see you, or you'll go see her, you do a couple of sessions, and if it's good to go, it's good to go.
Does that help? Oh, sorry.
Go ahead.
Does that help if the baby's still breech too?
Yes. So Kate specialized in turning a breech baby, and so if at 34, 35 weeks they're still saying your baby's looking breech, I'd get in Kate as soon as possible. I think it's easier than having the doctor try to manipulate it. There are a few other manipulatives you can do if the baby's looking breech, and that's standing on your hands under the swimming pool, in the swimming pool, and lying on a ironing board inclined. But Kate can do other stuff too. That seems less woo-woo. She's just really great, and she knows a lot about how to get labor going. I think anyone is great, but she's the one I used, so I put her in there. And you might want to start the acupuncture if you are going to go with that, and you are okay, your provider is okay with it before your due date, because it takes 3 or 4 sessions with your acupuncturist. They will say, okay, the first time we're going to do this, the second time we're going to get a little bit more intense, the third time this. So, and they're probably 3 to 4 days apart. So you want to start anticipating that if that's the route you want to go. If you're someone who's really pretty nervous about being induced, you might want to start that like at 37 and a half, 38 weeks with the okay and the blessing of your provider. Okay, so these are in order of my opinion of how effective they are. Then we get to evening primrose oil. No medical provider will ever say you should take, do the evening primrose oil, but midwives will, and doulas might suggest it, or as a doula, I might say, you might want to do a little research on evening primrose oil and see how it can get labor going. But a doctor won't say that. It's not dangerous. It's just one of those things that's enough on the fringe. They're not going to say it. So my suggestion is to do any of your own research on this or any other consumptive augmentation. So yes.
What about oregano oil?
Oregano oil, same thing.
Okay. There's a whole slew of them.
There's a slew of them, and I have them all in. If anyone wants to look at my doula training book, they're all written down. As far as there's black cohash, there's blue cohash, there's all those. So if you want to look at this later, you could look at all that. Again, as a doula, I think it's a little bit outside my scope of practice to recommend anyone do that. But I also know that as a couple, if you're willing to try that, as opposed to walking in and getting Cytotec or Cervidil, I'm gonna say do your own research, but there is other stuff out there. But yes, all that stuff. Oregano, castor oil is a big one. What castor oil does is if you consume it with orange juice or whatever the online regimen says, it loosens all your ligaments in your body. So what happens is you have a major diarrhea episode, and it just flushes everything out, but everything's so loose that it just starts really expanding everything. So again, do your own research with all those consumptive augmentations. But if we're looking at that compared to going in at 42 weeks with a whole bunch of fear and saying I'm going to get Pitocin, I'm going to get that, I would say that those are the better alternative. But it's something that you guys have to figure out on your own, and make that clear with you, and I also wouldn't hide it from your doc. There's no reason to hide it from your doc. They need to know, and you can ask their perspective. I imagine you know what the answer is going to be. I mean, they're not going to say you can't do it, but they're going to probably have a whole bunch of reasons why they don't like it. So it's just up to you. The next thing is the stripping of the membranes. So your bag of waters is attached to your cervix, and it's at the same time as it's closed. So if you can imagine blowing a balloon up, and the cervix is the nipple part of the balloon, and the bag of waters is the rest of it. There's a little sheath that also is connected, so the bag of waters goes all the way around, but it is still attached to your cervix. It's not just floating around in there. The stripping of the membranes is just the doctor going in with his or her finger and taking and swiping the membranes around and removing them from the cervix. So then your bag of water is a little bit more floaty rather than attached to your cervix. This can often get things going, and I would definitely encourage you, if you've tried these other things and nothing's happening, to make an appointment at about 40 weeks and 4 days or 5 days or something like that, the Friday before perhaps the weekend, and seeing if you can go in and get your membrane stripped. So a lot of times it gets things going, sometimes it doesn't. What you can expect is cramping and tiredness, because the other thing that it does besides just agitating in there is it does release a hormone that gives that cramping and tiredness throughout your whole body. So that, you could expect that, but that is definitely something you can advocate for, okay? Doctors, again, might have reasons for not doing that. They might say, you're not a candidate for that. That's not gonna work. But I think it's worth a try. And then I think you try to, how to advocate for attempting a natural augmentation. Start to discuss this with your OB at about your 38th visit, but I would even go before that. Obviously, if you're too far before it, it's a moot point, because if you're talking about it at 35 weeks, and you're talking about how to augment at, if you go beyond 40 weeks, you have some time. It's not like time is an issue with this, but it's more something to start talking about their philosophy around augmentation and what they suggest, because you want to go in there and say we want to deliver this baby as naturally as possible, if that's true. And I strongly believe that augmentation needs to at least begin as naturally as possible. And if the OB wants to do an induction, you try these methods before with his or her blessing. Okay, so if they're saying, Lindsay, you are 41 weeks and 2 days, we're not going to let you go past 40 weeks. You need to kick it into gear, because at 42 weeks, that's game over at that point. But I would have had that conversation with them prior, like at 39, 40 weeks. Okay. So those are some natural augmentation options. And the reason we would use those is to avoid the synthetic augmentation options, which aren't terrible, but if we can avoid them, it'd be great. So synthetic augmentation, there's a couple. The first one is called a Foley balloon. I, as a doula, have never seen it used. I think it's getting used more and more. I had someone who took my class last year, and she had it done and sings the praises for it. It basically is a catheter that's inserted into your uterus, your cervix, and so your cervix has to be a little teeny bit dilated to even get it in. So it's inserted in, and then a balloon, and then it's pumped up, and a balloon starts expanding in, sorry about the heater noise, in the cervix, and it gets it, and sometimes that's all the cervix needs to just start expanding on its own, okay? So, and then eventually the Foley balloon just falls out because you are dilated enough that nothing's holding it in there. So that is something you can ask for. If it seems like things are, if you're walking around and you're 37 weeks and you're 1 centimeter dilated, and then you're 38 weeks and you're 1 centimeter dilated, and then you're 39 weeks and you're 2 centimeters dilated, and then you're 40 weeks and you're 2 centimeters dilated, and you're 41 weeks and you're 2 centimeters dilated, and they're starting to say, we need to get things going and get this baby out, that's when you can say, how about the Foley balloon? Can we try that? And again, that is a medical procedure, so you would be doing that at the hospital. I don't think you get to just go home with it. In fact, I know you don't. Okay? And it's non-chemical, which I kind of like which basically are the same thing. They are a suppository inserted into the vagina that dissolve, and they act the same way that semen would act in there. It is a cervix ripener, both of those are, and it just could be just a thing to get things going. Now you would use those when you are not dilated at all, but you need to get things going, whether, for all the reasons that we talked about earlier. They ripen the cervix, and the difference between the two of them, Cytotec is the off-label drug. So Cytotec is actually a drug, I believe, for people who have a seizure condition. And it is also used for a D&C if anyone has ever had a miscarriage. So it opens your cervix, and it's off-label use for this particular intervention. But it is so commonly practiced that it's just well known that this is basically what Cytotec does. It's not FDA approved for this particular activity, and there's no regular dose because it's not FDA approved. So, but do not be afraid if your doctor is saying we're going to give her Cytotec, because the doctors know the dosage and just what they need to give. I'm just telling you the difference between the two. Cervidil, of course, is FDA approved, does have a regular dosage, and is much more expensive because it has gone through the FDA approval. So that is the main difference between the two. They act the same way. One has been FDA approved, one hasn't.